This video will cover paroxysmal nocturnal hemoglobinuria, which is an immune hemolytic disorder that can lead to red blood cell disease. Let's anchor ourselves. This image takes place at night with a yellow pond filled with round red buoys. This should bring us to paroxysmal nocturnal hemoglobinuria. Let's start with a pig. You can clearly tell it's a female pig, and she doesn't look like your usual pig. Looks like some mutation has allowed her to stand like humans. This represents the pig A gene, found on the X chromosome, which is the usual cause of this disease. Next, it's a bit hidden, but work with me on this one. You see the anchor on the side of that vehicle? It represents GPI anchor proteins, which are decreased in this disease. Doesn't the letter G sound like the name of that vehicle? And since the vehicle is going downhill, we can remember that GPI anchor proteins are decreased. There's a public health campaign happening here for AML awareness. This represents the fact that these patients are at increased risk for developing AML. See that bottle of red liquid? It represents intravascular hemolysis because the liquid isn't actively spilling, although you can tell that it did spill earlier and that blood looks all sticky and clotted. That represents thrombosis, which these patients are at increased risk of. Moving on to that female character from a well-known cartoon. Doesn't her name kind of sound like DAF or start with DAF? DAF or DAF, or even if you want to say the full thing, decay accelerating factor, is a cell surface protein on red blood cells that is decreased in these patients. She's giving Mean Girl vibes because she's thinking how she can get out of that conversation with her so-called pig friend. She's thinking of using the excuse that she has a headache. Headache in this case represents decreased ACHE, or acetylcholinesterase. Doesn't acetylcholinesterase, if shortened, sound similar to headache? Next, take a look at that beehive that has a bunch of vines around it. This represents CD59. The number 5 sounds like beehive, and the number 9 sounds like vine. CD59 is also decreased in these patients. There's some 2 identical beehives up there. They represent CD55, which is also decreased. I personally wouldn't want to swim in that lake, but the mermaid has no issue with it. The mermaid represents membrane inhibitor of reactive lysis, or MERL, another red blood cell surface protein that is decreased in these patients. And MERL kind of sounds like mermaid, right? There's a cool toy monorail train there, but it looks like it costs $14, $15, or $16 to play. It's also sitting on a granite table. The granite table and monorail represent granulocytes and monocytes, which can aid in diagnosing this disease. The numbers 14, 15, and 16 represent CD14, 15, and 16, which should be decreased on monocytes and granulocytes. Another one that should be decreased on granulocytes and monocytes is CD33, which is represented by the inscription of the caliber of the flare gun. Oh, and the flare gun represents fluorescent aerolysin, or FLAIR, which should also be decreased. Going back to the vehicle, you see how the front of the vehicle says compliant with a green check mark? That represents increased sensitivity to complement lysis. Doesn't complement sound like compliant?